can go ahead and take it away. And then at the end, when Lindsay is done, we will just take whatever questions you have, and we'll also draw for a review course. So,
All right. Well, let me introduce us first thing. If I can get there we go. So you just saw Dr. Kathy Baldridge, who's one of our, she's actually the lead APEA nurse practitioner education specialist here at APEA. And she's been with us, I've been with APEA now, I think 9 years, if I've done the math right, from Louisiana. And she is putting out our brand new clinical guidelines and primary care book at the beginning of next year. So we're really excited about that. So she's got a wealth of knowledge to share with us here today too. So welcome, Dr. Kathy. And then we have Jennifer Smith, who is almost Dr. Jennifer Smith. She's working on her DNP in Kentucky right now, and she's another of our full-time NP education specialists. And she teaches for our family nurse practitioner program. Does a lot of great work inside of APEA and also as an ER NP. And she is working on our upcoming certification questions book that'll be out hopefully next January, February as well too. And so welcome, Dr. Jennifer. And then want to introduce myself. I'm Dr. Lindsay Luther. I'm in Columbus, Ohio, and I'm one of our full-time APEA NP education specialists as well. And I am going to be leading that project, doing the certification questions book. But here's the part that you all care about and why you've given us your time on a Saturday. So you are probably wondering, now that you have finished your program or getting close to finishing, how do you start studying for this great big exam that you need to pass in order to start practicing as an NP? So here's kind of a step-by-step of what we recommend. The first thing that you need to do is really get familiar with whichever exam you're going to take. So whether you're going to take an ANCC exam or an AANP exam, you want to go to the website for the certification board and you want to download the exam blueprint or the content map for your exam. And this is going to help you to learn how you're going to be tested when you go to take that exam at the end of your program. So it's going to help you to develop a study plan. Now, after you've reviewed the blueprint and you know what you're going to be tested on, it's a great idea to take a review course like one of our APEA review courses, because this gives you an idea of the concepts that are most likely to appear on the exam. And it also helps to kind of quickly, over 2 days of re-exposure, figure out what are your strengths and what are your weaknesses. Now, ideally, we want you to do this in advance of your exams, at least a month before, up to even 6 months before. We have some students who take a review course even when they're just beginning their nurse practitioner program or their clinical part, because it's a great way to get you ready for clinical as well, to get access to a lot of these things that you're going to see day to day. But at least a couple of weeks before. The idea is that as you go through the course, you're highlighting any areas of weakness, and then you're going to use those weaknesses by building a study plan. Building a study plan is super important. It makes sure that you have enough time to study and also enough time to do all of the other things that you need to do, whether that's being a working nurse or maybe you're into fitness, maybe you've got a family that you're helping to take care of, whatever you need to do. So the idea is to build a plan that makes the most of the time that you have available. And you definitely want to have a study plan by the end of your last semester or a few weeks before you take your certification exam. Now, you want to update your plan after you take a predictor exam. So a predictor exam is a 150 question practice certification exam. It's online and it mimics exactly what you'll get when you do your real life certification exam. And at the end of that practice test, you will get a report that gives you a score that tells you, am I ready to take the test yet? Or do I need to work a little bit longer or a little bit focus more on these areas before I test? It'll also tell you hey, you're really great at cardiac. Maybe you've been doing cardiovascular nursing for years, but you have a little weakness in women's health, or maybe you have a little weakness in prescribing for psychotic disorders, whatever your area might be. So if you're in psych. So it's going to give you an idea of where to focus in on those weaknesses. And you want to do this a little bit of time before your exam, probably about 2 weeks or more, not so far out. Sometimes people will do one earlier in the program, and that's great, but we recommend a second one within a few weeks of the exam, and it can really make sure that you're ready to go. And then lastly, you just need to practice, practice, practice. So do as many practice questions as you can, review areas in your resources or your course manuals from the review course or from your academic program, and really plug in any holes that predictor exam helped to identify. Most students do well studying between 1 and 4 hours per day. More than 4 hours a day is probably not effective. We know that brains don't have unlimited capacity for focus. And so 4 hours of deep work is about what we are able to do and still get that information into our brains. That's good news because it means that you don't have to study 12 hours a day for the next 2 or 3 weeks. You can just do about 4 hours a day and get a lot of good material from that. So here is what the predictor exam looks like if you were to purchase it from our website or from the discount link that Dr. Kathy shared earlier. The goal of the predictor exam is to find out where are the holes in your knowledge and whether or not you're ready to take the exam. So here's what that predictor score report would look like. Once you've done your 150 questions, you'll get a report that looks something like this. And I want to draw your attention to the arrows at the top first. Do you see how the total exam time that this student took to take their exam was 1 hour and 18 minutes? That is only 78 minutes for 150 questions. That is really fast. I would call that too fast. So the first piece of advice I would have for this student, and the first piece of feedback this report gives us, is that this person probably needs to slow down a little bit. Now, they got a score of 65%, which puts them in this kind of intermediate zone, the yellow zone, where this person is at risk for not passing. The red zone means that you're not ready yet. You need to do some more work. If you take the exam now, you're probably not going to know quite enough to pass. Yellow's kind of on the fence. What you're aiming for is that green score of above 70%. And that score is what tells you that you're highly likely to pass the real certification exam if you were to take it today. In fact, that's about 97% of people who get that green score will end up passing their certification exams. Why only 97, not 100? Sometimes people have bad days, and there's just always that room for error. So after you have looked at your overall score and the time, you can come down here to this little plus sign next to each topic area. And this is going to be the most important button on this the entire score report. Because when you click this button, it opens down this list of all of the content that you were asked about. So you don't get to see the actual questions that you were asked, but you do get to see the content areas, the topic areas, and also what domain you were asked questions in. And these domains are the same as what is listed on the AANP exam, and they correlate very well with what is on the ANCC exams. The ANCC is a little bit different in that each of the domains for the different specialty areas is a little bit different. But these are really what we do, the core of being an NP. So assessment, diagnosis, planning, and evaluation. So how do you check a patient for hyperlipidemia? How do you make that diagnosis? How do you develop a treatment plan? And how do you evaluate if that plan is working for you? So based on this, we can see that this person has some work to do with how to evaluate the success of treatment for hyperlipidemia and how to diagnose a murmur. they also have some difficulty with understanding the impacts or complications of a ventricular septal defect. So those are all areas they should go look at in a clinical guidelines book. And we recommend that clinical guidelines book because we don't want to be using references that are like, maybe up to date, or other references that are much more about the expert opinions of individuals. Instead, we want it to be solely based on clinical guidelines and standard of care, and evidence-based practice, because that is what the certification exam will ask you for. So here's another example. This one is the area for men's health, and clearly the student needs to work a little bit on BPH, hypogonadism, prostate cancer, and kidney stones. And it looks like pharmacology and evaluation are their areas of bigger weakness. So that's where we would advise the student to start. So after you have identified what your areas of weakness are, you're going to start building that study plan. You're going to plot out all those areas of weakness, decide what you're going to study for each of those areas and how long you're going to need to study it for. Be as specific as you can. So here's an example of what that might look like. Let's say in endocrinology, I really need to review my diabetes pharmacology. So I am going to spend 45 minutes reviewing pharmacology for diabetes, and maybe I'm going to make myself flashcards or do some practice questions. For thyroid test interpretation, I'm going to do some practice questions for 30 minutes. For EENT, I'm going to go back over the center criteria and how to decide if a patient should get a strep test and whether or not, or what antibiotics I would treat them with. And so once I've identified what I need to study and how long I need to study it, then I start building my calendar day to day. And honestly, there are apps that do this, but I think good old piece of paper, here's one of mine from this week. I just print one of these out and I block it out based on what I need to study or what I need to work on. So obviously put in the time that you know that you need to be other places, like at clinical or exercising, relaxing, whatever. But then be very deliberate in how you're going to study those different areas and when you're going to do it. Remember to take breaks, plan for breaks. So you usually want you want to break about once an hour, at an hour being the longest stretch of studying. All right. So we get asked a lot about practice questions. When you're answering practice questions, it's so important that you use a system. And this is something that you will do over and over and over again as you are doing practice questions. And by the time you get to the real life certification exam, the system is going to be so deeply ingrained in your mind that you're not even going to have to think through the system. So here's a practice question, and we're going to work through the system that I like to use, that we like to use when we answer questions. So the first thing that we're going to do is read through the stem of the question, which is this part at the top. And it says a 19-year-old female reports malaise and cough for the past 3 days. Which finding is most specific to the diagnosis of pneumonia in a patient with cough? So that's our stem. Our stems are going to contain background information and also a question. Now, sometimes that background information is honestly not super important. And this is a case where that is so, right? So we have our 19-year-old who has malaise and cough for 3 days. That really does not require, that part of is not really required to answer this question. The question is, which finding is most specific to the diagnosis of pneumonia in a patient with cough? So the first thing we're going to do is find that question and say, what is this question asking me to do? So there's our question, and it's asking us to identify the most specific finding in pneumonia. Most specific, okay? So as we look at the answers, we need to be thinking about what are the key words in this answer, or in the stem, that are going to lead us to the right answer. Is there anything here that's irrelevant? We can just cross off anything that's irrelevant. And there are certain words that you want to pay extra attention to. So think about words like most, first, priority, typical, likely. Those are going to be the kind of words that can absolutely change the meaning of the question. And then also check for negative words in particular, because if you miss these, you will get the question wrong, okay? So here we can cross off this extra information in the stem. It's not helpful to answering the question. Then we're going to recognize that these are those keywords we need to pay attention to, most specific to the diagnosis of pneumonia. Oh, one of my slides is out of order, so I'm going to skip that one and go back. All right, so step 3, we're going to try to answer the question before we look at the answer choices. So I promise you, you can, even if you come up with a great answer, sometimes it's just not in the list. But what we're going to do is try to come up with some very specific findings in pneumonia. So we might take all of the things we can think about pneumonia and divide them into 2 categories. And this is something you can do on your whiteboard. This is part of why they give you a whiteboard. So we might separate those findings out into not specific and specific. We know that shortness of breath and chest pain and malaise and fatigue, those kinds of symptoms can honestly happen with more than one diagnosis. Fever can increase respiratory rate. Even Rales and sputum production. Rales is certainly more specific to pneumonia than to some other things, but there are other conditions that can cause Rales as well. We know that a couple of very specific things are increased tactile fremitus and egophony, and obviously our diagnostic findings, which are infiltrates and consolidation on a chest x-ray. So we have 3 options or 4 things: tactile fremitus, egophony, infiltrates, consolidation. Those are our best guesses. Now we look at our answer choices. We look to see if one of our answer choices is there. And you can see here that from our list, we have option B, increased tactile fremitus. Now, this is the place where a lot of people want to stop and they say, circle it, moving on. Don't stop here, because we always want to go back, reread the question, and make sure that we understood it, okay? Make sure that you understood the answer to the question. Now, I'm going to go back for just a second because this slide was out of order. We've already found option B, and we have selected that based on what rereading the question and also based on it being part of our list. But we sometimes don't have the one that we thought in the list of options. And if you can't identify right away the answer that you came up with, if it's not in there, what you're going to do is go through the 4 options that are available to you and select the best answer or select your best guess. So you can cross off any of these choices that you know are incorrect. And if you don't know, just pick the same option every time. So on your certification exam, it's going to be randomized. Sometimes, it's not like they're going to be, what is the correct option is going to be different every time, right? Sometimes it's A, sometimes it's B, sometimes it's C or D. But if you always pick C when you don't know, statistically, that's the best way to guess, because you'll be right probably 25% of the time. Okay, so sorry about that. Let's get to here. Okay, so a couple other tips for answering questions. If you're being asked to prioritize care for patients, which is common, use some of the strategies that you learned when you were taking your NCLEX and also some of the strategies you use in clinical practice. So think about airway, breathing, circulation. If you have a patient who, let's say they have a burn and the burn is on their neck, the first thing we're worried about is their breathing, right? We're first going to be worried about the fact that that burn is really close to their airway. That's always going to be number 1. And we're going to deal with that before we deal with wound care or whatever else. The nursing process can also really help you here. Know that we start with assessment and we don't move on to diagnosis until we have finished our assessment. And then once we've made our diagnosis, we work on a plan. Then we implement that plan. And then finally, we evaluate the success of that plan. And those 5 things should look really familiar to you, because those are pretty much the 4 domains that AANP uses to assess you on their certification exam. They kind of lump planning and intervention together. All right, so Maslow's hierarchy of needs is another one. We're always going to take care of physical needs and safety concerns before we worry about psychosocial concerns. Think about if ever you are asked about a scenario in which you have to conserve resources. Think about your triage ones. We typically want to help the most people that will benefit. And sometimes there are patients that require more resources than they're going to benefit from. So, I know you all are familiar with disaster triage. So that's really only for those kind of disaster high resource situations. And then stability is a huge one in the NP world. So always we deal with unstable first, people that could become unstable. So what does that mean? Could become unstable is like they have a chronic disease, but it's got a like COPD, but they're having an exacerbation and their breathing is deteriorating. Or maybe they're presenting with hives and we're worried they're going to go into anaphylaxis. And then we think about stable patients, acute needs first, and then chronic needs after that. Okay, so we're going to end up with a few of these frequently asked questions that we get all the time. And then we can quickly share with you what kinds of things are in the different course blueprints for the different specialties. So we get asked all the time, what certification exam should I take? And typically it's AANP or ANCC. And you know what? I just fixed it on the other side, but not this one. AANP just released their psych exam. So there is a psych exam now for AANP. There still is not an acute care. So AANP does family, adult gerontology, primary care, psych, and emergency nurse practitioner. Now you're going to choose either of these boards, but not both. There is no reason to do both. It does not benefit you in clinical practice at all, and it costs twice as much. So just pick one and go with it. They're very similar, both certify you, and you want to look at the exam blueprint and the reference lists for each one. Here's a quick comparison of the two. ANCC, once you get your authorization to test, you have 90 days to complete it. AANP, you have 120 days. ANCC has a few more test questions, 175 versus 150. Notice that both exams have these pre-test questions. These are ones that are still being validated as reliable questions for use to be scored items. So they don't count against you when you take them, even if you get them wrong. However, you have no idea which ones they are. But as a good strategy for managing anxiety, if you see a question and like you're thinking, I don't even know what this means, or I've never heard of this thing before, it can really help you to just say, oh, you know what? It's probably one of those pre-test questions. I'm going to choose an answer because I can only get a right answer, if I mark one, but I'm not going to stress about it and I'm just going to move on. You get a little bit longer to answer those extra questions at ANCC, and then here are what your credentials would be. One difference between the two is that ANCC is mostly multiple choice, but they do have some alternate formats. So there's one where you might get a chest that's divided into 4 quadrants, and you have to drop a little pin in one of the quadrants to identify where you might hear a heart sound. So that's called a pin question. There are some drag and drops where you have to rank things in order. So you might see that with a question about which is the highest level of evidence for 3 different research studies. So highest, middle, and lowest. And then sometimes you can get a picture in ANCC. That picture will come with multiple choice options though. So meaning like you'll get a whole stem, but there'll also be a picture like a chest x-ray or maybe a retinal image or, I don't know, a skin lesion. You're still going to get a multiple choice question in all of those 4 options. And then ANCC also does a couple of select all that apply. So you'll get 5 or 6 answer choices and you'll have to select multiple options on those. All right. So we get asked a lot about test anxiety and how to manage this. And the first thing to do is to adequately prepare for the exam. So use active learning strategies when you study, use retrieval practice, make sure you take care of your whole body and your mind. Obviously, it's very difficult to do well on an exam if you're not sleeping and eating well and exercising and having some fun and relaxation. There are also a few really good things that you can do to help your body and your mind relax both before and during the exam. So one body-based strategy is to release physical tension, and you can do this by squeezing as many muscles as you can access for about 5 seconds and then relaxing them for 5 seconds. Take a few deep breaths and repeat that a couple times. And that's something you can do even in the middle of your certification exam. You can also do it when you're sitting in traffic and you're like kind of losing it a little bit. I like to use that one in this situation. And then mind-based strategies work really well when you use them leading up to the exam. So visualizing yourself walking into the testing center and opening up your exam, and every question is something that you know and you're doing great and you know it. And then you walk out and you've got that paper that says that you passed. Using self-talk is positive self-talk is helpful as well. Stop telling yourself how nervous you are, how anxious you are, and instead tell yourself, I'm so excited, I can't wait to be an NP, and I'm really looking forward to passing my exam, and so on. Okay, so we do have additional information, and we will try to get you these slides so that you can review them later, but going back through those practice questions, this is that system that we recommended. Use active learning strategies when you study. Make sure you pay attention to both the right and the wrong answers when you're doing practice questions, and choose the right material. We find that students love, love, love to study things that they already know because it feels so good to know stuff. But that's not the best way to prepare for an exam. You want to focus on those things that you want to stay away from, like that you feel like you don't want to look at. And then we've got our links for the exams. Now, here are the content areas for AANP. So AANP gives us a breakdown of the populations that are covered for the different exams. And so this is how they break them down. Notice that in all of the exams, adulthood has the highest focus. Family, adult gero, primary care, and psych mental health, adulthood is going to be the primary focus. Older adulthood as well is a pretty big focus in these. But psych has a good deal of adolescent and pre-adolescent and children, and so does family. So don't ignore those sections for your exam. We don't get the population breakdowns for ANCC, but we do get the how they test you. So I told you that the domains are a little weird, a little different compared to AANP, and they're all a little different from each other, but these are the domains. So for acute care, adult gero, about 23% core competencies, and then 45% clinical practice. Professional role is a big one. So don't skip those professional issues modules, and definitely make sure that you understand, things like end of life care and things like that come up, and what your role is in those as the practitioner. Here is psych. You can see ANCC has some different domains. Again, scientific foundations, advanced practice skills, diagnosis treatment, psychotherapy relationships, and then the ethics, legal principles, cultural care, that whole professional issues thing. AANP breaks it down for all of these categories as assessment, diagnosis, planning, evaluation. Now, just to be different, ANCC here has almost the same categories for the family nurse practitioner. There are assessment, diagnosing, planning, implementation, and evaluation. Whereas AANP, they just updated their exam blueprint, so 2024, it is just assessment, diagnosis, planning, evaluation. And notice that assessment is a big category. So we have, I think because we did a lot of online programming, in particular during the pandemic, we've seen a little weakness in the area of physical assessment and some of our assessment strategies. So make sure that you are focusing on assessment if you're an F&P student, because it's a pretty big chunk of the exam for you. And then lastly, our adult gero. primary care NPs. The domains here are pretty different, pretty well spread across AANP. And ANCC's is assessment, and then diagnosis, planning, evaluation are all sort of lumped into that plan of care category, and then professional practice. So check out the blueprints online, and that is the end of our presentation, but we're happy to take questions. If you have questions, if you can put them in the Q&A, that just helps us to not lose them from the chat. So if you'll stick them in there.
So Rose had a question about, what is the best method to manage her time?
So if you do the math, 150 questions, 3 hours, it's about 72 seconds per question. But I like to cut that down because I like to have extra time just in case. So I would practice setting a timer for 5 minutes and trying to do 5 questions in 5 minutes. So 60 seconds each. So 5 questions, 5 minutes. Do it again. 5 questions, 5 minutes. Do it again. 5 questions, 5 minutes. Practice in 5-minute chunks and see if you can keep your accuracy while keeping it into 5 minutes. So 60 seconds each gives you a little wiggle room so that you have time to go back to anything that you flagged, or you have time to even like take a break, a little breath in the middle of the exam and kind of calm yourself down if you need it.
Yeah. And if that didn't answer your question, Rose, I'm not sure if you were talking
Oh, I think she froze.
specifically about the test, or if you were talking, maybe let us know and we'll the end. Am I back?
Yeah, you kind of froze, and so you weren't
Okay.
sure if she was talking about the test or what was the other part?
Are developing a study plan. So yeah, so just let us know if that answered your question. And I am going to post in the chat, Heather Darmetko is the winner of the review course.
Oh, congratulations, Heather.
Congratulations. So if you will just send me your email address so that I can make sure that the office staff have that, and they'll send you instructions of how to get that.
Yeah. So I saw, before we answer the other questions, I saw in the chat that Miguel Lopez says that he's very nervous and hasn't been this nervous since the NCLEX. I think that that's a healthy way to feel. Like it's common to feel that way. That means you're taking it seriously, which you absolutely should. One thing that is nice about all of the NP exams is that they are not adaptive tests. So unlike the NCLEX that would get harder when you were doing well, these don't get harder when you're doing well. So if you're doing well, you'll probably know that you're doing well as opposed to feeling like it's just hard.
Kimberly said, do you know the current pass rate of each exam?
Yeah, so they are usually in the low 90s. The AANP family test, the score dropped to I think 82% or 84%.
Somewhere around there, lower
In
80s.
2023 or in 2022, I should say. And the thought is really that that's probably related to pandemic issues, but there's not really any way to know that.
Yeah.
I don't think the scores for 24 have been released yet, or for 23.
I think they were, but and there were some improvement. I think they were back up to like 86.
Okay.
For AANP, and ANCC remained pretty steady in the
So
lower for FNP.
Mariamas asked if there's a time limit for when you can take boards after graduation.
So every year we do surveys for students who take the predictor exams, and one of the questions we ask them is how how long they waited to take the exam. And what we found year after year is that your best time to take the certification exam is within 3 months of graduation. The further you get away from graduation, the more the first time pass rates decline. So the recommendation is that you really plan to take the certification exam within 3 months of graduation. Like my face is lost on it.
Yeah. And I don't think that I think that if you have graduated more than 5 years before you take the exam, there are things that you need to do to qualify to take the test. But I think that's the only time limitation. Don't wait. Do not wait 5 years. Don't wait 1 year if you can help it.
Don't wait.
Yeah.
So I did tell someone, and I saw a question in there that will help. So this is the Clinical Guidelines in Primary Care, 4th edition book that you will find on the discount link. And I will go ahead and share that too. So you can scan it if you want to. And then someone asked the question about, do the predictor exams correlate? And so, you know, this is a great way to study, like Dr. Lindsay said. If you go to the Clinical Practice Guidelines book, it has all evidence-based practice. All of the questions in the predictor exam are evidence-based practice, and use that to study by. If you missed an assessment question on hyperlipidemia, then go to the hyperlipidemia chapter, look at the description, the etiology, the risk factors, incidents, assessment findings. All of that is part of the assessment domain that you will be studying for. So it's a great way to study and remediate and prepare for the predictor exam as well as the certification exam. So if you're taking a predictor exam through your university and you're doing them routinely, then I would encourage you to use the report like Dr. Lindsay showed you and go remediate in those areas where you missed questions. And then Rose says preparation for a study plan. Rose, I know that I'm Gen X, but can I tell you that I live and die by my day planner, and that is how I get all of my work done routinely. And so that's what I encourage you to do. It's great to have a digital calendar, but for some reason, I feel like your brain can process what it needs to process if you have it written out. So for the week, you look at everything that you have to do. If you're having to work 7 a to 7 p on Monday, then you put that on Monday. And you may not have any time that you can study on Monday, because like Dr. Lindsay said, your brain just may be done at the end of that. So schedule yourself a bubble bath when you get home. Tuesday, if you're off, then you plan out. Tuesday morning, cardiovascular is a very weak section for me. I'm going to spend 3 hours on cardiovascular. I missed some questions in dermatology, so I'm going to spend 1 hour Tuesday afternoon on dermatology. Go to those sections in the Clinical Practice Guideline book, review the areas that you missed. If you have access to QBank, go to the QBank and tell it to give me questions in cardiovascular, and then you work through those questions. That is a great process for doing that, but you need to have it mapped out on a calendar. And if something comes along and you just cannot spend the 3 hours that you're supposed to spend that morning on cardiovascular, then you immediately go and schedule yourself more time to do that. So it just really helps you stay on track with your studying. If you've only got 4 weeks to study, then you back it out and you figure out how much time that you need on each topic to cover every topic over that 4-week period. So that's a great way for time management.
So seeing a couple other questions in here. So one that I can answer quickly, we do not actually, so the boards do not explain how they score the exams. They each have a passing score of 500, but what we can't tell you is whether each question is worth the same amount of points, or if some questions are worth more than others, or if you get partial credit for a multiple answer. They don't tell us any of those things. So a score of 500 is a passing score, and that's really all we can say. And then another question that I think is such a good question is, like, what do you do when you're tired of studying? Because you will get tired of studying. And I think just like anything else, it's really important to take breaks, but it's also really important to build discipline back in. So like, sometimes just there are things I don't want to do or work I don't want to do. I just tell myself I have to do it for 15 minutes. And then once I get into it, I'm already into it, and it's, I'm already doing it, right? And then it's easier to keep going. If you can't do that for 15 minutes, see if you can do it for 10 or even for 5. And if maybe you give yourself a reward at the end of each 45-minute session or whatever, but or get some accountability with other people who are just as committed to this as you are. Some of your classmates can be really helpful. Okay, so Clarissa asked about the predictors. They have to take predictors at the end of each block. Doing well on the class exams, but not these.
Yeah, and then she clarified further down that what they're taking is the PEDS exam, the women's health exam, and the 3P. So those are competency exams. They're not predictor exams. A little bit different. Competency exams just assess your knowledge in that one particular area. But again, a lot of those diagnoses are in the clinical practice guidelines book that you can use to remediate.
And I would add to that the difference between taking an APEA exam and the difference between a classroom exam is that classroom exams are designed to test what you learned in class. And sometimes what you learned in class is not everything that you might be asked on a certification exam. And so if you're, it is a great habit to get into to focus on more than just what is in your classroom exams, and to get that clinical guidelines book and learn some more about the areas kind of around what you've learned in class. I would definitely be doing that and making sure that, when you're studying for a classroom exam, typically you're kind of thinking about the weight that your professor gave to certain items, and you're honing in on the things they spent the most time on or that they emphasized. But the truth is that may not be always an accurate reflection of what a certification exam would expect you to know. So make sure that you're kind of just expanding out there. And then Amber, oh, go ahead, Jennifer.
And we have already removed it from the Q&A, but someone asked if you could flag a question and go back to it. And the answer is yes, you can, but I would recommend you go ahead and pick an answer, because you could run out of time or just get so excited at the very end of the exam and hit submit and forget to go back. And then you have a 0% chance of getting that right if you don't pick something. So Dr. Kathy says she picks B for Baldridge and she moves on. So pick B for Baldridge, put a flag. And if you have time to come back to it, then you'll at least have an answer there. But you can do that. You can flag them and come back. So.
Yes. And for the PEDS and women's health competency exams that you were talking about, the study plan is really the same. And working through those questions, because you really should have had that material in your course, and you should have seen some of those things also in clinical practice. And so speaking of that, it's always important that you also really look at the evidence-based guidelines, because sometimes what you see done in clinical practice is not necessarily following evidence-based. They may have a very valid reason for doing what they did, but if you start answering questions based on what you saw done and it wasn't evidence-based practice, then you're going to miss those questions. So go search the guidelines for those things that you have missed.
And then Reveline asked, read in the booklet that if you don't pass your exam, you have to do CE hours to get a new authorization to test. So that's correct. So both of the boards require you to do, basically it's remediation, and you can take a review course like one of our review courses, or you can do CE elsewhere, but they will send you a score report that emphasizes the domains where you struggled the most, and then you have to submit some CE saying that you addressed those weaknesses before you test again. I'm not sure if both of them are 15. One of them are they both 15? Dr. Kathy, do you know?
Sorry, I was typing, so I really wasn't.
Oh, how many CE hours they have to do if they don't pass the
Have to
first
do-
time?
Yes, they have to do 15. And so even if you took a review course prior to taking the certification exam, I would encourage you to take another review course. If you took one of our live review courses, there's a guarantee with that. And so if you don't pass the certification exam, you can retake the review course at no cost to you. And when you retake it, you will earn the 15 plus, you earn a lot more than that, but you will get the 15 continuing education credits that you need to retest.
Someone asked for a picture of the clinical practice guidelines book, and I can't put that in the chat. So I'm going to show you again that if you click on our links, this is the one we're talking about, and it's got everything you need to know for primary care. So hopefully that helps.
Someone just asked to see the slide about the study plan again, so I'm gonna put this up here for just a minute and then we'll go back to that link.
I also just want to make sure that we touch on that some people don't pass the first time, and some of those, you may be some of those people that are here during this webinar, and that is okay. It happens, things happen with test anxiety, or maybe you just didn't prepare as well. Just get back on the horse, okay? Get a study plan, take the predictors, see what your weaknesses are, and get back at it. So I have a neighbor who, I think he failed the bar exam 3 times before he passed. And do you know what we call him? We call him an attorney. We call him a lawyer. Nobody knows that except for me, because we're friends. And so it doesn't matter if you fail. The point is that you're going to get back on that horse and you're going to study really hard and you'll pass.
And so Rose asked the name of the review course. It depends which specialty you're in. So if you are, we have recorded courses available for psych and acute care. There's a recorded course for family and adult gero primary care. And then there is a live on webinar or an on-site review course live for family and adult gerontology that you can take as well.
Correct. And so you can go to apea.com and click on courses, and it will tell you, pick your specialty, F&P, psych, mental health, acute care, and then how to purchase those. And what I'm showing on the screen there, these are our next on-site locations that we will be in, and then the live webinars. And so those are live online.
So Siobhan asked, hopefully I said that right. I think it's Siobhan, right? Siobhan asked if she took the live review in the first week of April. How long do you have access to the material? So if you took a live on-site review, you have 30 days of that bonus view of the material we presented live. And then your online materials, I believe, are 6 months. Is that right, Dr. Kathy?
Yes.
Okay.
Yes.
And the live webinar it's 2 full days, and there's supplemental materials online. So it's a total of like 30 something CE hours. It's a lot of hours that you get. Amber asked about the 120-day deadline for authorization to test, and can you reschedule the test? You can reschedule it, but I'm not sure how long the window is after that 120 days. You'd have to go to the website and look at it. You can definitely reschedule within the 120 days, but I would definitely check sooner rather than later.
Right. So I'm assuming, Amber, that you've already gotten your letter that says you are good to test.
Yeah.
Okay.
Yeah. So I would so with that letter, there's probably information about extending the deadline in there. And so I would go refer to that and see what it says.
Mm-hmm.
Now, Andrea asks, is it recommended to take the predictor before you start studying? So that's one option. Yeah, you can. So we almost never recommend taking it more than twice, right? So once kind of towards the about 4 to 6 months before you're going to take your exam, and then once when you're getting really close to taking the exam. The first one is so that you have an idea of what your baseline is and what areas you don't need as much focus on and where to focus instead. And then the second one to really predict whether or not you're ready to take that test. All right, Kate.
Like mental health, currently the review course is not available to purchase for the public. It is only through universities. But that is being redone and it will be available to the public, I believe, at the end of August, September, somewhere around that area. So it's not going to help you very much if you are going to be certifying before then, but yeah, sorry about that confusion.
Sorry.
I know.
And then we have a real exam coming next week, going to take the APEA predictor tomorrow, what to study after the predictor exam. So Kayla, once you have your score report, which you'll get right away. So first things first is take that exam as true to the real experience of what you're going to do next week. So when you do your predictor, make sure you're in a room by yourself, go to the bathroom first, try not to have any water or anything on your desk or any other apps open, lock your phone out of the room, whatever. So take it in as real life as you can. And then once you get your score report, I would suggest starting with the areas of red and just reviewing them as efficiently as you can. Once you've got all your red areas done, hit the yellows. And if you have time, maybe spend the day before the test just quickly looking over a couple things in the green. Don't drive yourself crazy. And if it says that you're ready to go, then I would just spend a week or a day, an hour or two each day, kind of looking back through things without going wild.
Yeah. Okay, so if you took the predictor exam and still didn't score in the green a couple of weeks before your scheduled exam, then use that as a remediation plan. You really don't even, I mean, depending on where you scored, I mean, if you scored in the 60s, review those areas that you missed, follow the guidelines that we gave you for remediating, and then go take the exam. If you were much lower than that, then you may want to consider postponing your exam, plotting out your study plan, and then maybe consider taking another predictor exam about a week to 10 days before your certification exam is scheduled, just to mark your progress. So, Liz, when you say practice test, what are you referring to? Because we do have practice tests on the website, but they are not predictive. And I think there are 5 unique exams with 100 questions each. But again, they're not predictive. They're just practice tests.
With the live review, they get 200 questions, not 2 exams. So
oh no, it's 200 questions, but the 200 questions are set up as 2 practice tests.
Of 100 each.
Yes, with their certification review course.
They're only to evaluate if you retained the knowledge that you heard in the review course.
Correct. So, Kawanza, if you took the live review course and you got both of your CE certificates with that and you were not successful the first time on your exam, you can reach out to us. We do have a live review guarantee.
Right. So you have to email questions at apea.com. You have to provide both of your CE certificates from your live course and your official letter from AANP or ANCC showing that you were unsuccessful, and then they will send you your options. You can do an on-demand or you can do another live if you wish. So on the predictor exam, there is no way to review the questions you missed. You will get that score report that is very detailed, but those questions are run for reliability and validity. And so in order to keep them secure so that they're not found in all these different question sites all over the internet, you're not allowed to review them after the fact. So that's why we do a very detailed score report. So for rationales, you really would find that in the Q bank. That would be the best place to do questions with rationales.
I think Lisa may have been asking about with the predictor, does it just sit in your account until you open it, or does it expire? So it does not expire. It'll just sit there until you open it. But once you open it, you have 3 hours to do the 150 questions, and then it will close and you will not be able to reopen it.
Yeah. How does our clinical practice guideline book compare to others? So I've used a few others in the past, but some of the things that I hear from students, and one of the reasons that we designed it the way that we did, is because it does follow that process of assessment, diagnosis, planning and implementation, and evaluation, which is also the 4 domains that you're going to see on the certification exam and on the predictor exam. And so students tell us that they love it. The information is bulleted. Students have used it for iHuman and Shadow Health, for case studies, and they just give us great feedback that they love the way the information is put together, and they feel like it's very easy to use and has all the information that they need to complete those projects, as well as study for the exam.
All right.
Good questions.
Yeah.
Yeah. Good questions.
Is there anything else y'all want to know?
We've got just a few more minutes. Thank you all for joining us. The next NP Student Power Hour is going to be June the 20th, and at 12 p.m. Central Standard Time. And it's going to be about migraines, brain pain, and Jennifer will be presenting that. We usually do it in the form of questions or case studies with bits of information, so it's very quick and concise. And again, we'll answer whatever questions you may have after that fact. So the QR code is there. You can scan to register for that. We do teach about pediatrics, Rose, in the review course. There's a whole section on pediatrics. That's pretty complete. Pretty complete. So they have not started sharing recordings with participants yet. So I encourage you that if you register to please try to be in attendance. If you are not able to be in attendance, then you will still get the evaluation link, if I'm understanding correctly, and you still can get the slide notes from that.
So Ephraim asked, when is the new clinical guidelines book going to be available? Both the new clinical guidelines book and the new question book will be available probably at the beginning of next year, 2025. So I wouldn't hold out for those if you're going to be testing in the next few months, because they won't be out till next spring.
Correct.
All right. Well, thanks everybody for spending your Saturday with us. Great questions. We really appreciate you all being here. And thank you, Dr. Kathy and almost Dr. Smith. I'm going to call you almost Dr. Smith every time I see you till you get that, till you walk across that stage.
Good luck, everyone that's going to be testing soon.
Hi, good luck.
Yes, and happy Mother's Day, happy Nurses Week.
Happy Mother's Day. Hey, there was a last minute question. If you are testing yourself in QBank, you really should be aiming for 90 to 95% on those exams. So that's really your goal. Good luck, everyone. We'll talk to you soon.
Thanks.